We're live. Hello, everyone. I am Dr. Alan Barthen, original owner of Cary Chiropractic Offices, also Cary Disc Center. In the future, we're also going to be Cary Physical Medicine. That's coming up in just the next few months. I feel really strongly about this subject on how to avoid lower back or neck surgeries. This has been a problem that we've had for years. Every chiropractor, when they're taught on how to take care of people with their bad backs, we were always taught that after a certain period of time, if it's not working, you got to get an MRI, and then you have to make sure you don't have a herniation. And if they do, the patient has to be sent off for surgery. However, in my first few years of practice, which started in 1983, we found that many times we sent people out for those surgeries and they came back worse. And many times they weren't any better at all. And over the years, I started looking for alternatives to neck and back surgery. And we finally discovered something about 20 years ago. And that's what I want to talk about, because now I've been practicing for 37 plus years. I've been doing non-surgical spinal decompression for about 18 and a half. And now we're really heavily involved with non-surgical spinal decompression. Now, I want you to know that Disc Centers of America is a research organization that helps me find the new research that's out there. They also help me with some marketing ideas and things like that. It is not any kind of a chain or anything like that. They are just a research organization that I use. And Disc Centers of America keeps us at a higher level of education. So what we are doing is giving our patients the very best care that's possible with the most recent information we have. From Cary, Illinois, there is nobody else that's board certified in being a disc specialist, which is what I am now. A board certified disc specialist, I think the closest one to me from Cary is maybe Mundelein, Dr. Doozy, and then there's some doctors on the North Shore in the city and in Naperville and Lake Geneva. However, I'm the only one within a lot of miles of Cary, Illinois, and I want to talk to you about how to avoid having a back surgery, because it's not a very successful procedure. Anyway, my purpose has strictly been to try to help people with the health of their spines without surgery. And we have gone from problem to problem. When we send these people out and they have surgery, they come back worse. And it turns out that the surgery is just too invasive. It does not address the real issues. Yes, they go after herniated discs and they cut them out. But after the surgery is done, these people end up having all kinds of post-surgical scar tissue that's inside, and that ultimately makes them worse, not better. So what we're looking for is something that's less invasive and can get people well without having residual effects of having to wait around and heal from the surgery. The big deal with backs nowadays is opiates, because opiates are one of the #1 reasons people end up being addicted, and they're addicted because of back problems. And we're trying to get people away from this. We're giving them alternatives that are less money, far safer. And having a back problem or back and neck problem is the #2 reason people go to a doctor in the United States. #1 is the common cold and flu, and #2 are spinal problems, namely pain. And not only will it cause pain in the back, but it will have what's called a radicular symptom that goes down the legs or down the arms into the hands. So I don't know how many of you have been to me before or how many of you know me, but I can tell you that what we are all about nowadays are disc bulges and herniations, which can cause sciatica. Also, degenerative disc diseases can also lead to herniations and bulges later on. They're all a real problem. Now, I don't know how many of you have had any extensive treatments for your backs already, but I can tell you this, that when we go after people, we want to know as much about them as possible. We are doing our diagnoses and trying to understand how their body is working and what the problems may be. Do not be surprised if we ask for MRIs. Now, you may already have some. Many times the chiropractic care fails. The physical therapy almost always fails for disc herniations or even had surgery. About 40% of all the people that come to my office for care, 40% are post-surgical failures. And what we have to do now is we have to try and straighten out the herniations again, plus we have to deal with the scar tissue that infiltrates the joints. So the big question is, how many people are still suffering with this. And chronic pain is the big deal here. You are not alone by any stretch of imagination. Of all the opiate addictions that are in this country, 85% start in a medical office because of a back problem. So don't feel like you're the Lone Ranger with this. Everybody, I mean, so many people have these back problems. It is amazing. And you just don't want to go there with the drugs. And after you have surgery, the pain is so much worse, you have to almost use opiates just to get by, because ibuprofen is not going to make it. It's not curative, by the way. They're still treating symptoms and not getting to the root cause of the problem. So are we on the right track? Well, we're not. And I'm not going to go into great extensive information on this right now. I want to spend more time talking about non-surgical spinal decompression, how we can help you without surgery versus knocking everything else the medical profession does with this. And incidentally, there are medical doctors on the West Coast now, orthopedic surgeons, that are using some of the same procedures that I'm using now. The number one thing that a lot of people don't understand is your disc is a live, living piece of material. It's not a piece of dead skin in between two bones. Most specialists believe that the vast majority of back pain comes from the discs themselves. Now, understand, discs don't have a direct blood supply, but they do have nerves in their fibers. And when these discs get irritated, degenerated, they tear, they rip, they herniate, they bulge, a lot of the pain comes from the disc itself. The two main causes of the disc problems are the degeneration and, of course, the herniation. What happens over time is these discs actually dehydrate. And when they dehydrate, they're no longer pliable. And when they're no longer pliable, they are prone to injury. All right. So the disc has got two major components. If you take a disc and you were to take a good look at it, it would look like the middle of an onion. You cut an onion in half and you see the annular rings that go around in that onion. It would be like the slice of an onion, only it's going to have a big pocket of jelly on the inside. And that's called the nucleus pulposus. And there's not going to be a test on this, so I won't test you on what a nucleus and an annulus are. But for the most part, what you've got are two different tissues. One wraps around the other. The annular rings around a disc, which is what the inside of that onion looks like, those rings, will sometimes start to tear or delaminate. And as they delaminate, the jelly, that nuclear pulposus that's inside, starts to squirt out. And almost always it squirts backwards into where the spinal cord and the spinal nerves are at, and that's where the pain comes from. And it can affect huge areas of the low back, cause back spasms. Most back spasms aren't just because they're back spasms. They're back spasms because your body's in duress as a result of severe nerve pressure. And this can be a very serious problem. Anyway, they don't have a blood supply, like I said, and they don't have any internal nerves, but they do have nerves on their outsides. Now, the disc acts as a pumping mechanism because it doesn't have a normal blood supply like we would think with capillary networks and arteries and veins and things like that. Every time you walk, every time you move, your spine is compressing and decompressing up and down with the walking mechanism, and that produces a pumping action in those discs. When the disc is getting compressed from a step, it forces water and carbon dioxide and spent nutrients out, and then when on the next step and the vertebrae come apart a little bit, it produces a vacuum in that disc and brings in fresh water, oxygen, and nutrients, and that's what keeps the discs healthy. By the way, a disc is made of about 86% water. They are very, very fluid. On MRIs, a lot of times we'll look at MRIs and they're black, and the discs are black, and the reason the discs are black is because they've dehydrated. The darker tissue is, the less water it has in it. And there are different conditions that discs can have, but the nice thing about non-surgical spinal decompression is it can handle all of these different issues because it works primarily by making the discs healthy so they can heal themselves again. You know, we're all told by the medical profession that cartilage after the age of 40 doesn't regenerate and doesn't heal, and that's wrong. They think it heals with scar tissue because they're using surgery, but that's inaccurate, right? This tissue will heal on its own if it's properly taken care of. Here's what a herniation looks like on an MRI. Now, what you've got is this black bulge going into this white canal, and where it says unhealthy, that's the herniation. It's bulging into there. You see the other discs are gray. That's because they have a lot more water in them, and therefore they haven't dried out, and they're still far more pliable. So the chance of them injuring and getting herniated is far less, although it can happen. But generally speaking, on MRI, when we're looking at herniations, the disc will almost always be very, very dark gray or black, and that's what this is a perfect example of. So nerve irritation in the low back, when you get a herniation, and sometimes they call it a slip disc. This is a misnomer of a term given by medical doctors years ago. Discs cannot slip. They are embedded with fibers into those bones. Those discs don't slip. The vertebra will move, but the discs cannot slip. But it's kind of a generalized term, kind of like rheumatism. Rheumatism isn't a real word, but it's been a misnomer in the healthcare profession for a long time. But when you've got herniated disc, or the disc is bulging or swelling out, it will cause pressure in the spinal cord itself and the nerves that come from the spinal cord, and they will cause conditions like sciatica. Oh, my sciatica, and they think sciatica is a separate entity of a problem. It's coming from their back. It's a back problem. It's not a leg problem. Anyway, what happens with the discs is they have lost their innate ability to stay healthy and stay hydrated. And that's a real issue. And when you're operating on a person and you're cutting disc material away, that does nothing to get that pumping mechanism going again, to get new fluid and oxygen and nutrients back into the joint. All right. All you're doing is taking the symptom away by cutting the herniation away and then sewing the patient back up. The approach to non-surgical spinal decompression is that we are going to reestablish that pumping mechanism so the disc gets hydrated again. And when we get proper nutrients and oxygen back in there, those discs will heal. This is a diagram of the mechanism, and I'm not going to spend a lot of time on this, but this is how it works. Now, the things that cause the pumps to fail, the big deal is age, obesity, trauma to the back, years and years of little traumas that have a cumulative effect, like a guy who's got a job that hurts his back a tiny bit every day, but after 30 years of doing that job, it's as bad as if he was in a major automobile accident. So trauma is a big one. Also, this can be aggravated by physical stress, chemical stresses, too much alcohol. Alcohol dehydrates the body. Smoking does everything to the body that's not good. Emotions can cause problems with this because when you're under a lot of stress, the hormones in your body change, and a lot of those hormones that change into hormones that produce inflammation. So it'll take a small back pain and make it feel much worse. Also, jobs that are sitting too long, like I am right now. Thank God this is not what I do for a living, but sitting for long periods of time cause a lot of compression on discs, as well as being overweight. Now, a little overweight's not the end of the world, but a lot of overweight makes a huge, huge difference. And my most successful cases are always people that are less weight, not more. So what are the current treatments today that we know of, and are they working? All right, traditional treatment, how the back and the neck is treated. You know, first you go to the doctor, you got a back pain, you go to your regular doctor, and he says, well, let's take care of this. We're going to give you muscle relaxants because the patient's got muscle spasms. We're going to give you pain pills because the patient's got pain. Now, the problem with this is when you treat symptoms and you do not get to the cause of the problem, you end up with a much worse problem. You've got a back problem. You've got muscle spasms. The doctor gives you these pills to knock those symptoms out. Your back feels better. You start using your back as if it's normal, and you damage it worse because it never got better in the first place. Now, physical therapy is known because physical therapists see everything as a muscular issue, I swear. And it's the muscles are usually going into spasm as a result of the condition. They are not the cause of the condition. Now, a lot of times chiropractic care fails too. I've been in practice 37 years. I had a lot of failures with chiropractic when there was herniation in the discs or even significant bulges. Acupuncture, again, is treating symptoms. They're putting these needles in. They're releasing endorphins into your body. This knocks the pain level down. It makes you feel better, but it does nothing to reestablish the pumping mechanism in the discs to get them rehydrated. It does nothing to pull the herniation back into the joint either. So what these all have in common is they're treating symptoms. We're not getting to the significance of the problem. All right, now this next photo is kind of ugly, and if you don't like looking at surgery, close your eyes for a second, because this is a photograph of a back operation and a guy who's having a fusion performed. All right, here's what it looks like. And not a good time. And these people are in pain for the rest of their lives. I've never seen anybody that had this surgery and had no pain afterwards. It just doesn't happen. It's brutal. And that surgery requires the body to produce even more scar tissue and more complications, including infection. And they don't do very well with this, but sometimes the doctor feels he has no choice but to do a fusion. Now listen, let's talk about these surgeries a little bit more. About 2% of the people that have these back operations die within the first 3 years. They're not always 100% sure why these people died. It could be infections. It could be too much trauma for the body. Most often, we believe it's just the dang drugs they have to use to kill the pain after the operation. And again, we're going back to the opiates again. But the death rates are significantly higher, especially in people that have to have the heavier medications after the operation. Now, there's a doctor, Dr. Eugene Kerji from Stanford University, and he performs these spinal surgeries. And he is extremely selective on who he does it because he only wants the best for his patients. And what he's trying to do is keep as many people from possible as having the surgeries, because this man who does this for a living understands the failure rate. In fact, on this, he even says less than 25% of the people that have the operation are even considered successful. All right, so this is something that should be done as a very last resort. But in our day and age of healthcare, it's not used as a last resort, and that's extremely dangerous. Here are some of the costs of back surgeries, all right? The cost for back surgery in the United States. And this information is about 5 years old, so the costs are probably even higher than this. $6,000 to $8,000 for endoscopic, $60,000 for a fusion, $80,000, $85,000 for a laminectomy. And these are all surgeries that end up with scar tissue afterwards. You've got additional costs that nobody take into consideration afterwards either. You've got all your prescription medications, the physical therapy. Sometimes a lot of insurance companies won't even pay for physical therapy after surgery anymore because it doesn't work. Then you've got the cost of the use of the hospital, the lost wages that people have when they're laid up and aren't working, and they lose a lot of money just because they're not working. That's a great thing about decompression. Nobody loses work because of decompression. They got to give me 1 hour of their day and they can go on and live their lives. All right. So these are some of the costs. Co-pays, costs of rehab, costs of medication, total out-of-pocket costs. If you've got really good insurance and you've got, say, a $5,000 deductible, you can be paying anywhere from $10,000 to $15,000, $18,000 as your part of the bill. The bill say $85,000 for the surgery. You still gonna, and you have good surgery, you still may end up having to pay $10,000, $15,000 out of your pocket. So whether you got good surgery or not, you're still going to be paying a lot of money. And the truth is, the surgeons frequently claim 95 to 98% success rate. The numbers I have seen, these numbers are supplied to me by Disc Centers of America, by the way. The numbers I've seen is most of these gentlemen and ladies are claiming about an 85% success rate. But that success rate is first year. The 5-year success rate, best as we can figure out, because they don't release the information. Maybe they don't have it, but the 5-year success rate for laminectomy and discectomy is less than 30%. You got, less than a 30% chance with all the costs and everything else of not having a successful surgery. And that's why so many people with those surgeries end up in my office afterwards, because of all the complications. Paralyzation. I don't know how many folks know the movie Home Alone. A man named John Hurd played the father in that movie. He is no longer with us. He died about 3 years ago from complications from back surgery. All right, so this is not a simple thing that anybody can do. And they keep trying to tell everybody, well, this is the very best and you have to have this done. I cannot tell you how many people have come to this office and told you have no choice but surgery. And they got here and they got better, because they do have choices, but most people don't know about it. And that's why I'm doing these webinars now. I was originally planning on doing these in restaurants, but COVID-19 took care of that. So now we're going to do it online. And I think this will be just fine. Alternatives. The alternatives to back and neck surgery. All right. Without the use of drugs and surgery. And there are a number of them. Now, remember again, Disc Centers of America, I'm not a chain operation here. We are not a franchise. This is a research organization, and they give us the information we need so I can stay on top of everything. By the way, if you're a member of Disc Centers of America, and I am, and there's about 300-400 other doctors in the country that are, we are held to a higher standard with this work because we are tested every year on the new research that's out. They expect us to be the best doctors of the bunch with non-surgical spinal decompression, because anybody can buy a machine and just use it, okay? You have to understand how that body works and how that machine is going to give them the best care you can possibly give them. Now, this Dr. Alan Dyer, who's on this photo right here is an acquaintance of mine. Dr. Dyer was the man that invented non-surgical spinal decompression. He was an orthopedic surgeon. He just died about 2 years ago, heart attack. A brilliant man, orthopedic surgeon from Canada. At one time, he was Minister of Health for Canada. That is like the Surgeon General in the United States. He was in charge of the whole system. When I found the research that he was doing online 22 years ago, I got a hold of him after several months of phone calls. Trying to get hold of the Minister of Health of Canada is a little bit of a challenge. But we talked, and he told me that things had been going so well for the research clinic he had in Canada. He had just gotten permission from the Food and Drug Administration to put 3 more research clinics in the United States. So one went in New York and one went in Chicago, and the third one went in LA. And when I said I'm 40 miles from Chicago, he was thrilled with that, and I got involved. Back then, he got me involved with the research work that was being done in Chicago, and the results were amazing. They were really, really good. Anyway, that's how I met Dr. Dyer. I wish he was still with us. He's not. He was also the man that invented the defibrillating machine. That's the one that puts a shock into the heart and brings people back sometimes when the heart stops. A brilliant man. The nice thing about decompression is over the years, we've learned more and more and more about it. And I'm sure Dr. Dyer would be thrilled if he knew how much more research was going on with this machine that he invented. But we can isolate discs. We can go after one disc at a time. The machines are now designed with sensors in them, so they can actually tell me how the body's responding to the care as we are doing it. And the whole idea here is to rehydrate and get the discs healthy again so they can heal on their own. Your body is so smart, it can heal anything that goes wrong with it if you give it a chance to do it. All right. Now, you see other machines and people call things decompression. We got Dr. Ho or Who or whatever he is on television with his decompressive back braces. Those cannot decompress. All right. You've got teeter hang-ups. You've got the gravity inversion tables, and people hang upside down. That's traction. And while traction is good, it is not decompression. Traction can never, ever pull a disc and produce a negative pressure inside. That's a vacuum. And you see this number of minus 160 millimeters of mercury. Well, that is how much vacuum is going on inside. It's the only technology by today's standards that's been measured and actually proven to show vacuum inside the disc. Everyday pressures on the disc. To give you an idea of how much we beat ourselves up through life. You bend over to pick up something that's heavy, like a 20-pound box, and you don't bend your knees, the end result is 800 millimeters of mercury, a lot of pressure on that disc. Even if you do bend your knees, you're still putting a lot of pressure on, all right? Lying down on a table, just laying down flat, you still have 40 millimeters of mercury pressure on the spine. The one thing that produces a vacuum in these discs and promotes healing is the decompression. So far, with today's research and standards and everything else, non-surgical spinal decompression is the only thing that produces the vacuum in those joints to produce a vacuum to bring the herniation back into the joint and also to get the disc to heal without scar tissue. This is more information on the pump. I don't think anybody really wants to sit there and look at that. So we're going to move on. Anyway, like I was saying, non-surgical spinal decompression does produce physical changes to the disc because it's rehydrating them. It's reducing the size of the herniations until the herniation goes away. All right, and it recreates the pumping mechanism. Actually, in the process of doing the decompression, it produces a pumping action, and we will actually, patients, sometimes the first time we ever treat them, they get off the table and they feel better already. Decompression is so comfortable. Non-surgical spinal decompression is so comfortable. The vast majority of our patients just close their eyes and doze off for a while because it's that comfortable. There's no pain in the procedures at all. Now, treatments on average the decompression treatments take about 30 minutes. And 30 to 40 visits. My more advanced cases can be 50, 60 or more treatments. And 12 to 20 weeks is 20 weeks is closer to average. But you're going to come to my office, you're going to go through decompression. We're going to take you off that table. We're going to put you in a therapy bay, and we're going to be using electrotherapeutics like interferential current that bring the inflammation levels down to help promote healing. We also use a lot of cold laser in this office. We have very specific lasers that we use that are specific for producing a frequency of light into the tissue that stimulates the genes to regenerate the tissue faster. All right. So these are the examples. There's physical therapy. So the patient goes through decompression, and then they go through physical therapy, and then we pull them out, and I use nutritional standards. We put collagen with hyaluronic acid as well as vitamin C into that patient every day, because as those tissues are regenerating and the genes are stimulated to produce new cells, we've got to make sure that the right ingredients are in the bloodstream to draw from so it can heal without the scar tissue. And as time goes on, we'll give the patient exercises. Sometimes we do have the patients do rehab here, but there's a whole plan. But you can really figure on coming here and getting worked on and being here for a good hour, sometimes an hour and 15 minutes. And it's worth every second, because you don't go through any pain in the procedure. You always feel better when you leave. Your lifestyle doesn't change. You can go to work, you can come home, you stay in your house, you don't have to rehab from surgeries, and you're just all the way around much better off with this, because it's so much safer. The 5-year success rate, I said, for the laminectomy discectomy is less than 30%. Our 5-year success rate is over 80%. My 1-year success rate is about 89 to 90%. How can you mess with that? It's so much better than surgery, there is no comparison. So what types of treatments work on the disc? And I've already gone over that with you. There's a slide we'll get rid of in the future. But the disc pain is really the primary point of most disc problems. And as we get older, the chance of a herniation gets worse and worse and worse. There are other things that decompression can help with, from hernia discs and bulges, like we've talked about. The problem is when these discs bulge out, they cause pressure on the spinal cord, which is called central canal stenosis or spinal stenosis. The joints in the back, in the far side of the back, will get very arthritic and become inflamed and swollen, and decompression helps that immensely, as well as neuritis, which is nerve inflammation because of all the pressure. As you are pulling these joints apart and taking the pressure off the discs and the nerves and the inflamed tissue, the body has a chance to heal itself. This is a really good slide. And the reason this slide is so good is because the image on the left shows a herniation between L5 and S1. That's the bottom vertebra with the sacrum. And you can see the bulge is sticking out into the canal where the spinal cord is at, and that it's herniated out so bad its gravity is actually starting to pull it down. If that's left like this for too long, it can break off. If that piece breaks off, you have no choice but surgery, because decompression is not going to help that broken piece. We can't pull it back up there. So this is a case that had decompression, and after several weeks, the image on the right was a post-MRI, and that shows the improvement. Now there's a lot more pressure off the nerve. Now, if that was my patient, I would continue on with more decompression until that was pulled in even more. But I swear this stuff works so good. It was exactly what I was looking for 22 years ago when I was looking for alternatives to surgery for lumbar disc herniation. Now, there's a number of studies on decompression. I can tell you this. We've been checked out by innumerable organizations. The ones that stand in my mind mostly right now are Stanford School of Medicine, excuse me, Stanford School of Medicine, Harvard School of Medicine, Johns Hopkins University School of Medicine, and Mayo Clinic. Harvard has got one of the most extensive research organizations I've ever seen. They have hundreds and hundreds of different doctors in charge of all kinds of different programs. The doctor that was assigned to look into non-surgical spinal decompression was a neurosurgeon. And after he did the research and looked at all the studies, he came up with numbers. He said that he could see non-surgical spinal decompression replacing 95% of all back surgeries for disc problems. It was that effective. And this is a neurosurgeon talking. It was that effective. So on decompression studies, here's the one by Mayo Clinic. Prior to treatment, the average pain score was 6.5 out of 10. And they had pain for more than 6 months. After 20 treatments were given over 6 weeks, 88.9% of the patients reported a significant decrease in pain from a 6.4 to 0.8, not even 1. That's a major improvement. They required less pain pills. There were no safety issues. There were no after effects. It was just getting fixed without the use of drugs and surgery. And 91% of these people return to normal activity. And I'm going to tell you something, through the procedure, while they're going through this, they can go on to their normal activities as long as they didn't have too much pain in the process. But the point is they did not have to change their lifestyles and lay in a bed with a back surgery and taking medication to get over this thing. They went on with their life. They just had to come an hour a day to get work done, and then they could leave. So how do we determine if you're a candidate for this kind of care? Because that's really important. We don't have the diagnosis right. We don't have the right information. I can't give you the best care that you deserve. First of all, consultation is really important. Then we do a pretty thorough examination. I need to know as much about you neurologically as possible. In fact, people will say, geez, I haven't seen a doctor do this kind of examination on me in a long time. They just throw them into a machine and get a picture and they're done. It doesn't work that way. Now, x-rays are very, very helpful because they will tell me how the bones relate to each other. You cannot see the discs, and I have to see the disc. So when it says MRI if necessary, it's necessary about 95% of the time because I want to see what the discs are doing. Once I know what the discs are doing, and I get a radiology report to check up on my work, then we give you a report of findings, and then we can give you the recommendations we need as to what are your best options to get better without the use of drugs. And yes, this is the place to be, or any DCOA doctor, because these people are the ones that are trained the most and know the most about taking care of these problems. And we will listen to you, and we are trained to know how to alter things. If a patient gets off the table saying, gee, that kind of hurt today, that's not supposed to happen, and we will make sure it doesn't happen again. So things happen, and everyone is different. So you have to understand the different reactions people will have, but they all get better. Now, this is really important to me, as it should be important to you. I am going to move the positioning of my cute little bald head here so I'm not in the way of the information. All right. This webinar, because you spent time with me on this webinar, all right, we have a special, and that's free consult and examination. All right. So all you've got to do is call our number, 847-639-0010. All right. That's 3 better than 007. 847-639-0010. And set up an appointment so we can sit down and talk very thoroughly and then give you a good solid exam. Now, if I feel x-rays are necessary, I'll tell you the x-rays are necessary. They will be $29 maximum cost. All right, we don't x-ray everybody, especially if they come in with x-rays from other offices, which they frequently do. And MRI actually gives me more information than anything else. So I will press most of the time for MRIs because MRIs give me an exact idea of what exactly is going on with that disc and how much work you're going to need. The more information I have, the better I can make my recommendations for you and give you the best care that you deserve for the money you're spending. Anyway, my name is Dr. Alan Barthen. Thank you for spending time with me. This was my first webinar ever. I was scared to death, but I think it worked out okay. Give us a call, 847-639-0010. Let me have a chance to help you without surgery. Have a really great day. We'll be doing another one of these seminars probably next week, and then we're going to go off into other information on neck problems as well as peripheral neuropathies. Have a great day. Bye-bye.